This is Talk to KEDI, sharing knowledge, liberating minds. Hello there. Thank you so much for joining me on another edition of your number one educational online broadcast, Talk to KEDI. Our topic of today is hypogonadism, also known as low testosterone. Also, you can also call it gonadal deficiency. In other words, in today's edition, we'll be talking about what hypogonadism is, the causes, symptoms, people who are most likely affected by this ailment, how it can be detected, prevented, treated, or even managed. My name is Felix Adeyemi. Welcome and get ready to learn. To do justice to today's topic is one of our top leader. He is an honorary lecturer, the owner of Service Center 294, located in Lagos. He is a highly knowledgeable TCM consultant. He is no other person than Mr. KEHINDE Adeyemi. All right, thank you. So, Mr. KEHINDE, you're welcome, sir. Can you introduce yourself to our audience?
Good afternoon, viewers. My name is Adeyemi KEHINDE, a naturopath and the owner of Service Center 294. At the same time, I'm a professional network marketer.
All right, sir. Thank you. Welcome, sir. We are very glad to have you on the show today. If you're tuning in for the first time, this is Talk to KEDI, your number one educational broadcast brought to you by KEDI Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and service in Nigeria. Welcome on board and stay tuned. Today, we are turning our attention to a condition that affects the hormonal balance, the hormonal health balance of both men and women, which is called hypogonadism. Some also call it in different names, but I would choose to call it hypogonadism, also known as low testosterone, or you call it we either call it low testosterone, or you also give it some other names. But however, many are struggling with the effects of this ailment, and yet they do not realize what is happening in their body system. Why is that? Why is that so? This is because the signs sometimes are subtle, and sometimes it's easily confused with many other health conditions. Thereby, people hardly recognize that they are suffering or they are dealing with hypogonadism. And at the end of the day, this goes undiagnosed for many, many years. However, don't worry, our guest is going to help us to break it down. He's going to give us the nitty-gritty of what we need to know about hypogonadism. So please hang on and stay tuned. Sir, I know you have some data to share with us. Can you please go ahead, sir? It's on the screen.
According to a journal released by the National Library of Medicine in USA, that is also governing us here in Nigeria in 2022, about 2 to 5% of men over 40 have clinically significant low testosterone, which rates increasing with age. The more you age, the more that thing comes down. Then up to 20% of men over 60 may experience low testosterone level consistent with hypogonadism. And primary ovarian failure affects about 1% of our women under 40, which can be considered a form of hypogonadism. This statistic has been on for some time and is increasing every day.
Wow. All right, we have heard it from our guests. Indeed, this is the time where you have to be part of this conversation. And how can you be a part of this conversation? Click on the link, share it with everybody that you know. Invite them to come and learn from what we are sharing today. Let them come and learn about hypogonadism, everything they need to know about it. And peradventure, you have any question, or possibly yours is contribution, or you have a testimony. Probably you have dealt with this kind of ailment, how you were treated, and how you got out of it. We would like to hear from every one of us today, whether it is question, whether it is contribution, or you have a testimony. Please kindly do that right now. Keep dropping your questions, your contributions, your testimony. I can assure you, before this broadcast ends, we are surely going to read them out. I'm going to attend to them one after the other. All right, Mr. Kenny Kedi.
Yes, ma'am.
Let's go down to the topic of today. I would like to start my first question with this, sir. I believe you are ready, sir.
100%.
All right. My question is this first question is in two parts. So I will start from the first part, and it says, in your clinical experience, how would you describe hypogonadism?
I would like to come down to the layman's
That would be better, sir.
Hypogonadism can be defined as a situation whereby body does not produce sex hormone, either men or women.
Okay.
That is what we refer to as hypogonadism.
Okay.
Either it's low or it's not, it does not even produce it at all. In men, that is when your testicles does not produce testosterone. In a woman, that is when the ovary does not produce estrogen and what have you. That doesn't release egg. That is when you say you have hypogonadism.
Oh, okay. Wow. Very well, sir. So, with this, sir, what are the key differences? Because I know there are different causes or different types of this. What are the key differences between the primary and the secondary hypogonadism?
They are very different.
Okay.
Primary wounds started from the organ itself. In men, we say testicles
yes.
does not receive
it's not releasing the testosterone.
Then ovaries does not
yes.
release the egg or estrogen or it's not ovulating very well.
Exactly.
That's primary aspect of it.
When the sex organ itself,
when the organs, the primary organs of production is not producing the sex hormones.
Yes.
But when we are saying secondary will normally happen from the challenges from the brain that fail to send the signal to the organs to do its work.
So when the hypothalamus is not
releasing
that signal,
that is it. Hypothalamus or
the
pituitary gland,
it's
not releasing the signal to the sex,
so that the sex organ can release
the egg or testosterone. That is when you say the secondary challenge.
Okay. All right. So I have your opinion outside this question. So I have with me. Could there be a possibility whereby this could be acquired, or it could be hereditary? Is it possible?
Yes, it's possible.
Okay.
It's genetic.
Okay.
It's genetic. Many of the causes
can you explain
for the men.
Yes.
Many of the causes for the men, you say that it can be due to the injury. Maybe somebody is doing an excessive exercise.
Yes.
Through the excessive exercise, men can have that particular challenge. Then infection can cause it. You understand?
Yeah.
When you have been treating too much of infection over the years, it can cause low testosterone. Or cause the damage to the testicle to perform its function very well. Or damage the ovary. Are you with me?
Yes,
then also, when you are using over consumption of certain medication, can affect you. There's some those who have already passed through the cancer treatment through chemotherapy, they can have that problem.
Because they're also dealing with a lot of
when you are trying to take out the cancer cell,
of course,
you can kill the good cells with the machine. Then also, it's genetic, as we have just said.
Exactly.
It's in the blood.
So some people, while they were giving birth to,
from their lineage of the family, you can pick it up. Exactly.
And nobody will know. You just think you're taking something else. Wow. All right, sir. So this takes me to my second question, sir. What are the common warning signs and symptoms of hypogonadism, both in men and in women?
Most of the common signs in men is something that most of us are living with, and we believe it's just one of those things.
Yeah.
But it's more deeper than what we are looking at. Because when you want to treat a lot of things, people are taking at they will be telling you the symptoms instead of looking at what causes it.
What causes it? Yeah.
You understand?
Yes.
Major symptoms for hypogonadism is low libido for men.
That's for men. All right.
Even also in women.
Yeah, they too.
You understand? Then erected and functioning for men. The transformer will not work. You understand?
Yeah.
Then at the same time, there's something called tiredness, unexplained tiredness. Then you'll be loss of muscle. You understand? Muscle strength won't be there. Then depression. setting. Infertility. Most of the causes of infertility can be linked with hypogonadism.
But why do what about the women?
The women, majorly what they normally do when they first of all see the symptoms from their menstruation. Irregular menstruation or complete absence of menstruation. Then dryness. They don't feel lubricated because of the absence of the normal.
The hormone is not.
Or the hormone is not coming.
So
it's not
everything that should accompany it is not going to be
no
secreted.
ovulation.
Okay.
You understand?
Yes.
It's inability to get pregnant. You understand? Hot flashes. Those are the challenges
that we
associate with the women home, and you know that this person is really suffering from what they call hypogonadism.
Okay. So, like you said, low libido.
Yes.
For both men and women.
Yes.
Is there another one that could be afflicted with both genders?
Depression is there too.
Depression.
Most of them can have depression because when you are trying to settle something, you're able to get it off. It will get to you.
Okay. All right. So that takes me to my third question, sir. As a seasoned TCM consultant, can you tell us how hypogonadism affects fertility in men and women? Because I know you talked about it earlier.
Yes.
About fertility. So can you dig deep? How does it affect both?
In a situation whereby your system is not secreting testosterone, it is very difficult for you to impregnate it.
Yes.
And at the same time, it will affect your erectile function. The erection won't be as sharp, as strong as it's supposed to be. Then it can give way to what they call a weak sperm, poor sperm, or heavy sperm. Sperm quality will be reduced, and the motility it will be very worse. Okay. You understand? So that's for the men. But because when the egg is not sound, I mean the sperm is not strong enough.
There's no way you can
swim down to where you are going because they are going to move faster.
Of course.
You understand? Most of them will die before they get to the destination. Then for the women, since the estrogen and progesterone is not being secreted,
of course,
you understand? There is no way the woman can ovulate because the menstruation is not coming.
Yes.
You understand?
Yes.
And when there is no ovulation, there is no production of egg.
So there's no way you can.
There's no way you can get pregnant. That is it. Okay. That is it. Then at the same time, because of the one that affects the pituitary gland, hypothalamus, that's the secondary. Those hormones that related with that one, luteinizing hormone and follicle stimulating hormone, if they are not present, the womb lining will be weak. It will be very difficult for such kind of a womb to accommodate pregnancy, fetus. You understand?
Yeah.
So that is it.
Wow, this is deep. So I would like to take you back. I want you to explain for us about, because I read about it and I was like, fine. If this can affect both men and women, that is loss of bone mass.
Yes.
That is osteoporosis. So can you tell us how this will actually affect them? Like what effects does it have?
Thank you, my sister, my brother. Let me put it this way. Most of the bone marrow challenges that we have is associated with the kidney.
Exactly.
You understand? And the kidney is the root of life. In TCM,
of course.
When your kidney is not sound well enough, there's no way you can be able to fertilize them. So it's from through the kidney you're able to generate enough bone marrow to produce enough bone marrow for your bone. You understand? Because without calcium, your blood cannot move. At the same time, your sperm cannot move. You understand? So the healthiness of kidney has a lot to do with bone marrow. I mean the body mass index. You understand now? So with that one they can take care of their bone marrow, I mean the kidney perfectly, you'll be able to solve that particular problem.
Okay. Alright, so sir, with that, having known this, that takes me to the fourth question I have for us, sir. How is hypogonadism diagnosed, and what treatment options are available when it comes to managing this condition?
Thank you. The best way to diagnose hypogonadism is through the blood test. That one will be able to tell us the availability of the hormones. You understand? If it is through the testicles, you understand? We'll be able to know this is where the problem comes from. If it's through from the ovary, we'll be able to know. If it is from the brain, the LH and the LH, luteinizing hormone and FSH, follicle stimulating hormone, to be able to know their level, to know that they are enough to settle, to be able to help the person to fertilize. And if not, then they have to use what we call in orthodox medicine. They normally use what we call hormone replacement therapy. You understand?
Exactly.
They give them some injection for the men
Pass new
to pass new to the head, to replace hormone, especially that of testosterone. They can do that. Then the same thing for the women too. They give them the hormone injection so that they can increase the level of population and the production.
Okay, sir. All right. So with that, how can hypogonadism contribute to other health problems? I want you to just tell us about it. How can it contribute? That's my next question. How can it contribute to other health problems? Can lifestyle changes like diet, exercise, like you said, someone that is doing exercise and has injury, so can all these things, or even stress? Because I know stress contributes to majority of a lot of conditions in this our age. We are all stressed out. So how can hypogonadism contribute to all these other health problems?
We cannot rule it out completely. You understand?
Yes.
We cannot rule it out. Let me pick it from the stress.
Okay.
99% of people in Nigeria are under stress. Every one of us. Because we are trying to make things happen.
Considering the economic
situation of things. Somebody used to say, they are not running after us, but we are running after something. Here in Lagos, or let's say in Nigeria generally, with the present security now, everybody is running. So the stress is there. Then also, hypogonadism, we cannot completely run in, for some people, rule it out from depression. Because it's part of life. You can't take it away from men and women. They need to enjoy themselves.
Of course. And when you cannot do
when you cannot do the basic things, thinking,
exactly,
depression, it can even affect you mentally. You understand? Some women, because their inability to conceive, they have been given a lot of names.
Of course.
And from there, it can get to them.
Of course.
Personally. You understand? Then will this if it continue without having a good diet? Because it can have a lot of problems. Malnutrition can be there. Then also there are some underlying ailments that also contribute more to the hypogonadism. If you have BP, it can affect you. It can create more challenges for you. Diabetes can create more challenges because the moment you are starting using their medication, it creates a lot of problems.
It's open up.
Or open up another thing entirely, which is part of where hypogonadism can come in. Then exercise play an important role. At least like thrice in a week.
So that can help manage it, right?
Can help manage. Can help manage. Exercise can help a lot of things. You can't run away from it. Exercise can help.
What kind of diet can help to manage?
Nigeria being who we are, 99% of our food swallow. You understand? They are carbohydrates. But more intake of fruit and herbs, vegetables, can help.
Wow, this is really been an eye-opening on topic. So this takes me to my next topic, sir. But before I go there, I would like to tell our audience, please, if you have your contribution, your question, please start dropping them in now, because very soon I'll be going over to the comment section to read our contributions, our comments, and probably our testimony. Anywhere you are under this lecture, please start dropping in your question now. This takes me to my next question, sir. I know that KEDI has some products. We have various products that support individuals battling with hypogonadism, and over the years, many of our distributors have recommended some. They recommend Revive, some recommend Vigor, some recommend Regime for managing these conditions. But since hypogonadism represents different symptoms in both men and women. Alright, so sir, could you kindly share how you recommend products for both men and women that are dealing with this condition?
This is my personal tip and secret.
Exactly.
You understand? So I will open it up because of KEDI.
Because of
we are one happy big family.
Yes, sir.
If somebody is having that particular challenge, somebody will tell you they have erectile dysfunction, it goes beyond. and you give them product, take care of erectile dysfunction, it will handle it because you are taking care of the symptom.
Exactly.
You understand? If you want to go to the root of that particular challenge, what you needed to do is just do what they call comprehensive treatment. You understand? How? First of all, detoxify.
Yes.
Colon is good for detoxification.
Okay.
After the colon for detoxification is just for 10 days. Then the next thing for you is to apply the product for the treatment. What are those products? I normally use golden seeds, vigor for the active, ultramega, and vitagen for men.
For men, okay.
Yes, comprehensive treatment.
Okay.
It will take care of that particular challenge and correct a lot of things in the system.
Okay.
Personally, for myself, every 3 months, I normally go on vigor essential, ultramega with vitagen and golden seeds. Every 3 months for a woman.
Wow. So what is the dosage rate of all this? Starting from colon, you said
colon is just 2 tea bags at night, lasting at night.
Okay.
When you are ready to
2 tea bags
bedtime
at night. Okay.
So then there are every day for the next 10 days.
10 days.
I experienced somebody in my office. They came to buy something, the product, especially colon, and was now telling the person how to use the colon. They said the person should boil it. After boiling it, they should take away the water and then they should chew the herbs inside the bag. I said, don't do that too. They said that's how their upline said they should do it. So you're on your home. I've had an experience over the year when I was about, is it not 8 or 10 years in the business? Somebody said such that they should chew it, and the person was eventually vomiting blood. He was arrested. Company said they didn't send him to do that. You are not being sent to do that. Just boil it, take the water, and drink. Don't eat anything. For the colon. Then vigor essential is 2 capsules daily. You may decide to use 2 capsules once by 3 p.m. It's the best time. Whatever you eat or don't eat. But that particular time, there is something called body clock in traditional Chinese medicine. If you can follow that body clock in traditional Chinese medicine, you'll be able to handle a lot of payments in this world. So by that 3 p.m., that is when your, how do they call it, male hormone starts working fully.
3 p.m.
3 p.m.
Is it this time? Does it work all over the continent? Like
everybody, every living body,
each person's country 3 p.m.
Everybody has what they call body clock.
Okay.
And it works with everybody.
Okay.
If you want to check it very well, early in the morning, do this. You see that one of your nose is working. By the time it's 12 o'clock, another nose will pick it up. Check it very well. They can work at the same time. You understand? So by 3 p.m., they should use 2 capsules.
Okay.
Every day.
Okay. For the vigor.
For the vigor. Then choreatic is 4 capsules in the morning, 4 capsules in the evening. After meal.
Both after meal.
Both after meal.
Okay.
Then vitagen in between meal. 1 in the morning, 1 evening. The same thing with ultramega in between meal. 1 in the morning, 1 in the evening. You enjoy it.
Wow.
Then for the women.
Yes, sir. So let's go to that one. Yeah.
I normally prescribe after detoxification, colon. I normally prescribe golden 6. I normally prescribe MMV. Then Eve's Comfort. When we have what we call it, Vita Prego, I normally give it to them. So we don't have Vita Prego anymore. It's MMV, Eve's Comfort, and golden 6.
Okay. What is the home dosage?
Golden 6 is 2 capsules by 5 p.m. That is when your kidney is working.
For the women?
Everybody.
Oh, everybody.
Everybody is supposed to use golden 6 by 5 p.m. Kidney is the most important organ in the body.
Of course.
And it's the one that is in charge of production, fertility. So use 2 capsules of golden 6. Even if the person is having another ailment entirely, let make sure they use golden 6 by 5 p.m. in the evening. You understand?
2 capsules.
2 capsules, 5 p.m. Then you use Eve's Comfort, morning and evening. The dosage is there. Then women, MMP is morning and evening in between.
In between male. Yeah. Okay. All right. We've heard it from our guest, Mr. KEHINDE ADEYEMI. Right now, I'll be going over to our comment section to take our questions, either your questions, either it is your contribution or your testimony. So I have a first question from Sandra on our IG page. She said, please tell us the causes and the symptoms of hypogonadism in women. The causes in women and the symptoms in women.
I have to go over it.
Exactly. Maybe she joined.
The causes of hypogonadism in women is when the ovary is not secreting sexual hormone. Do you understand?
Yes.
That is the primary cause. But the secondary cause is when the brain is not releasing the necessary signal to the ovary to do its work.
To produce that hormone.
That hormone. Do you understand? So that will create low level of luteinizing hormone and follicle stimulating hormone.
Yes. So we've you have heard it, Mrs. Sandra. The thing is that one of these causes is either from the primary
or the
secondary, which is the first one is whereby the gonads is preventing them from receiving signal. When your sex organ is prevented from receiving signal to produce that hormone, or maybe it is coming from the brain when the pituitary gland or the hypothalamus is not sending the right signal so that the hormone can secrete, the sex organ can secrete the necessary hormone. These are the causes. But she said, what are now the symptoms? We've talked about the causes now. So now the symptoms.
The symptoms in women.
In women that women would see.
Number one, absent or irregular menstruation.
Is that the most common symptom?
Most obvious one.
Absence
or irregular menstruation.
Okay.
Low libido.
Low libido. Exactly. Low libido. Yes.
Hot flashes. Then vaginal dryness.
Yes, sir.
The inability to conceive.
That's infertility. Can this be linked with PCOS or every other condition?
They go along together.
They go along together.
There is something called, normally when they say PID.
Yes.
Do you know what it means?
Yes.
Pelvic inflammatory disease.
Yes.
Which means telling you it's not only one. There are plenty. That's what they call pelvic inflammatory diseases.
Exactly.
It's not one. So they are the same thing.
So if one is treating this particular ailment, you can possibly be attending to other sub ones that is right there. Okay. All right. For my second question, this is from Chikeze Grace on our Facebook page. She asked and said that does alcohol or obesity contribute to deficiency of testosterone?
Seriously. Smoking, alcohol consumption, they are not our friends. It can inhibit a lot of things in our system, not just solely hypogonadism. Even it can relate to infertility, ED, exactly. Alcohol. Like I mentioned, but it's going to affect some organs, which is going to also leak to the organs that's producing the.
And same as obesity.
Same as obesity. Yes. When you're having too much of flesh in your system, it will affect your system. It's more or less that there's when you have a generator and the plug.
Is related with every other element. It is essential for one to watch their diet.
Exactly.
But I have a question here, sir. What if it is a doctor's prescription for an individual to either be taking what's it called, to be smoking? Can that still contribute?
I've never heard of that.
There are some that have some mental issues and they will tell them just take some number of cigarettes to calm them down. I've seen it before.
It's possible.
Can it contribute?
Let me share this thing with you.
Okay, sir.
Another man's food is another man's poison.
Okay.
You understand?
Yes.
So, and whatever is going to inhibit your optimal health and you are consuming it, is not good for you. No matter what. Throughout the world now, everybody is campaigning against smoking.
But yet, some people are still smoking, even though they are liable to die young.
They know.
Yet they are still doing
and they will tell you they are better live beyond that year.
Exactly. But once they've gotten to a particular age, nothing can happen to them again.
It's a lie. When it's the right time for God to deal with them, it will deal with them. He will deal with them. You understand? Everybody has his own time.
Exactly.
You may be thinking nothing will happen to you today. You are escaping it. It's not that you are shifting the goalpost. By the time the ball enters the goalpost,
there's nothing you can do again. All right. We have indeed heard this massive educative words from our guest today. If you're just tuning in, he has dig deep to letting us know the causes, the way you can identify it, how it can be diagnosed, and even he gave us his own formula, how he handles treatment relating to hypogonadism or any other fertility related issues. Thank you so much for tuning in, and thank you for coming, sir. We are very grateful. Right now it's time for us to take our Dr. Eti for today. So sir, could you do us the honor of reading out the Dr. Eti for this broadcast?
On behalf of Dr. Cap, yes, this is what he said. He sent it to us from China. He said, hypogonadism can affect energy, mood, and sexual health. If you notice persistent fatigue, low libido, or mood changes, get your hormone level checked today. Early detection and treatment can really improve your quality of life. Stay aware, take charge of your health, and be careful. Now, taking it from there, it says early detection and treatment can greatly improve your quality of life. So stay aware and take charge of your health and be careful. With that, it is a wrap on this edition of Talk to Kedi. I hope you have learned something valuable today about hypogonadism, also known as low testosterone or gonadal deficiency. Special thanks to our wonderful guest, Mr. KEHINDE Adeyemi, for taking time to share with us from his wealth of knowledge. Thank you, sir. In case you joined the broadcast late, don't worry. The full video will be available on our Facebook page at KEDI Healthcare Industries. It will also be on our Instagram handle at KEDI Healthcare_official. You can also check our YouTube channel at KEDI Healthcare. Also, please feel free to also check our mobile application, KEDI Care app. Feel free to watch and share with your loved ones. Don't forget to join us for the next edition of Talk to Kedi, because it promises to be insightful. Thank you so much for tuning in. Until I come your way next time, I am Felix Adedoyin. Bye for now.